So we had one epidemic that was sort of eclipsed by the pandemic, the COVID-19 pandemic. I'm curious how you'll address the opioid crisis here in Michigan. So starting with Governor Whitmer, how can you address the influx of fentanyl with the ongoing opioid crisis here in our state?
Well, let me start with this. You know, I often talk about my own mother who died of brain cancer right after my first daughter was born. I was in that sandwich generation where I was taking care of two different generations of my family. And I know how hard that was. And that's why I've worked so hard to expand access to health care. I worked with my predecessor, Rick Snyder. When I was in the Senate, we got Medicaid expansion done. And today, 1 million more people have health care because of that work. There is no question that we have got an opioid crisis in this country. It was a greedy pharmaceutical company that buffaloed the people of this country and has created a lot of addicts. That's why the resources that we are putting into addiction treatment, the resources that we are putting into ensuring more people have access to health care is so incredibly important. This is a space where we've got more good work to do, but we are making progress.
Mrs. Dixon?
Well, we've seen a massive increase in overdoses. 2021 was the highest number we've ever seen. And we can directly correlate this to the Whitmer-Biden policies of having an open border. We know that drugs are pouring across our border every day. We've seen overdoses rise since this administration took office. It's been devastating, and that's why I've presented my Safe State plan to put $1 billion new into policing, to make sure we have enough police on the streets. I just went to the Oakland County Crime Lab the other day. The woman there was testing two giant blocks of cocaine, and then she pulled out one of fentanyl. I said, where did that come from? And she told me it had come from just down the street in Pontiac at a house. I asked her how many people that fentanyl could kill, and she said millions. If we had more officers on the streets, we could be preventing a lot more overdose deaths. I want to make sure that we have the backs of our cops and we invest in our cops and we make sure they have what they need to fight this horrible scourge on our country.
Governor Whitmer, if you'd like a rebuttal, I'm also curious if you'd expand things like access to Narcan or anything else to address the problem tomorrow.
Absolutely. So I think one of the big things that we haven't yet talked about but need to is about crime. We know that our police put their lives on the line every single day. I, as governor, have made too many phone calls, attended too many funerals, and that's why I have delivered over $1 billion more for law enforcement in Michigan, to recruit, to train, to make sure they've got the wraparound support so that they can do their job. It is a hard job, but this is, I think, one of the most important things that we haven't really yet talked about.
Thank you, Governor. Mrs. Dixon, Narcan?
Narcan is obviously very important. We have seen that we have our Walmart pharmacies that distribute it a few times a year, and it's also our police officers have it around the state. But I think it's very important to note that it's not just about going out and having cops on the street. It's also about taking care of our corrections officers and making sure that when someone commits a crime, that we get those drug dealers off the streets and they can't commit more crimes and cause more death in the state of Michigan.